To narrate my story, I think I have to go back 15 years, 16 years to be exact. In 1985, it was detected that I had a malignant growth. Even though I had some idea that it could be a malignant one, I postponed going to the doctor just with some kind of a ostrich mentality maybe, not wanting to know the truth.
The first symptoms of cancer was noticed when I passed some blood in my urine, but I didn't take it too seriously because I was totally ignorant of what cancer was, other than what we see in the movies.
Many people are afraid to come into the doctor. They're afraid to report the symptoms. They may have some problem, but they're not sure. And they think of cancer meaning that if they have cancer, they're going to die. So it's better not to know at all than to come in and to find out. What they don't know is that if they come in, and the earlier that they do so, the better chance they have of being cured.
When I went to the doctor, of course, he examined and he told me that I have to get myself examined thoroughly, in the sense I had to go through a test called needle biopsy. So that was done, and the verdict came that I had malignancy in me and surgery was a must.
And when I was told about it, it did not exactly unnerve me or demoralize me, but I was always getting worried about the consequences.
Well, a simple way to describe it is that our body is made up of millions of cells, and all of them are controlled and they know how to grow and what function to carry out. When some of these cells of our own body become haphazard, they grow without control and they start spreading all over. That is when they start taking over our body, and that is the simple way to really describe cancer.
There are lots of myths associated with cancer, but if we were to focus on a couple of important ones, I think the most important one would be people think it's contagious. Even in, educated people come in and they say, can I eat with the children? Will it be contagious? And I just want to make it very clear, cancer is not contagious. You can sleep with the person, you can eat in the same plate and nothing happens, it's not contagious. If you were to ask me what is the most important factor which causes cancer in this country, undoubtedly it's tobacco. And I think we need to realize that changing lifestyles, giving up tobacco usage in any form, it's not just cigarette, it's not just BDs, the pan, masalas, the gutkas, the tobacco which you have in any form, all of them contribute significantly to causation of cancer, and they're preventable.
See, all of us know that smoking is a very fashionable entity. Irrespective of the age, they smoke. So one of the important aspects of tobacco-related cancers are basically cancers of the head and neck area, cancers of the lung, cancers of the voice box, cancers of the stomach, cancer of the urinary bladder.
I will now come to the biggest myth of all, and that is that cancer equals death. I think that's a lot of rubbish. There's tremendous amount of research which has gone in today to see that cancer is a curable disease. About 2/3 of cancers are completely curable, which means that that will not be the cause of death for that individual. We're not saying the patient will not die, all of us have to die, but we will not die of cancer. That's 2/3. And the remaining 1/3, there's a tremendous amount we can do to keep them comfortable.
There are very, very many different types of treatment available for cancer, but the three common ones are surgery, radiation, and chemotherapy. Surgery means you do some sort of a operation on the patient. Chemotherapy means you use different types of drugs as intravenous or as tablets. And radiation would be what layman people call current therapy. Basically, it's giving a lot of radiation to a certain particular part.
It was very, very shattering. I was devastated. My family was devastated. I didn't know what was in store for me.
My first response was I probably felt sorry for myself that I had an ailment which, if not properly taken care of or treated in time, could become fatal. Fear of death was not there. I didn't really feel that. But I always felt that it was going to be very uncomfortable to others when I had to go through the whole thing.
Patients who are very depressed, people who use maladaptive coping methods to deal with their situation, in them the immune system was compromised. Whereas patients who are positive, who have the fighter instinct in them, who use adaptive coping methods, who were psychologically supported, in them we found that the immune system was more buoyant.
I was admitted and total mastectomy was done, radical mastectomy. And when I came back, I told everybody, now that I'm been in school, you know, I am a teacher by profession and I had taken leave from school, I'll go back. So that will be the best thing for me because my mind will be diverted. I'll be in the company of those little children and it will be a different scene altogether. That was a very, very bold decision of mine because everybody was surprised, why should I go back to work so soon? But that really changed my life, I should say. The reception I got when I came back to school, the school management and my friends and my students were so happy. I still remember one incident, you know, where father mentioned that Mrs. Shetty is back and she's perfectly fine. He said that, and that really worked miracles. Boys started cheering and that sound is still so fresh in my mind. So I make it a point to tell people that whenever there is some signs, they should go to the doctor. Particularly when I go for my walks, I see this domestic help going from their home to their place of work with mouth full of pan and keeping it in their mouth, which is very bad. They say that chunam in it corrodes the inner lining of the mouth, and oral cancer is one of the common outcome of that. So I tell them, please don't do that. Nobody knows for how long anybody lives in this world because death is certain. But how you live your life to the fullest, that's what makes the difference.
Whenever a patient is afflicted by cancer, it's not that that is the end of him. He has a lot to live for. He can live for others also. Even if he's going to be there for a short time, he can make the life sweet, both for himself and the others. But that depends upon the mindset you have. So when you are happy and you are making the others happy, and you say even in your pain you are seeing some pleasantness, I think that is worth living.
One of the most important weapons we still have in our arsenal against cancer is that of hope. I think we've all seen patients who have hope, who live longer, who tolerate treatments better, who have less side effects because they have hope that they can actually make a difference in the outcome of their disease.
Without hope, nobody can survive, even with best of medical care and prompt attention from everybody. If you don't have that hope, that I'm going to be all right, that determination, nothing can work.
It's been 10 years since I've undergone the surgery. After a couple of years of physical readjustment to the situation, both mental and physical, let me put it that way, I've been able to lead a very normal life. My activity has not been hampered in any way, either my hobbies, professional activity or any other type of activity. I drive a car, I have my tensions, my moods, etc., etc.
I'm very happy, and I want others also to take up the same attitude towards the disease so that they can defeat the disease. The disease did not defeat them.